Okay, I'm ready. Good morning, everybody. We're so happy to be bringing you a video today, and I have as my guest, Phyllis Jolley from where, Phyllis?
Amedisys Home Health, and I work out of the Trenton and the Ringo office, mostly the Trenton office.
And Phyllis is one of our favorite guests that we have that comes here with all of our seniors because she just interacts with our seniors and they really love Phyllis, and we just appreciate her taking her time to be with us today. But Phyllis, we're going to be talking about fall reduction. Now, we're not talking about fall season and pumpkins. We're talking about falling on the floor. So we're talking about fall reduction program. And does Amedisys Home Health, do they have a special fall reduction program?
We do have a fall reduction program, and it involves the physical therapist, occupational therapist, and speech therapy, and nursing. And they have several different activities, exercises. We go by the doctor's orders, a very, very good program.
Well, that's good to know, and I understand that about 7 out of 10 seniors that fall, they fall at home.
Yes, they usually do, because they're there more, and there's more obstacles there, and they're working and doing what they usually do, people usually do at home, so they have a higher incidence of falling.
One thing that you can fall on real easy is throw runs.
True. Your environment, I found that out this past year. Your environment has a lot to do with your falling, injuries, types of injuries. Throw rugs, I know everybody, even the younger folks, stick their toe up under the rug and end up falling. In the kitchen is a big place, bathrooms, and beside the beds, and just all over the house. We put throw rugs. It just seems like it's more cozier. But throw rugs and those thick, cushiony rug things that you put in the kitchen to stand on when you're washing dishes, that's one of my big things.
You stick your toe under it and then
Stick your toe under it, the edges turn up. But other than that, there is several different things in the house, such as your pets, your dogs, your cats. They'll get under you, cause you to fall. And one thing that a lot of people don't think about is we like to wear baggy clothes in the house. And we get tangled up in the baggy clothes. Slippers, a lot of times our slippers will be big and we get our feet all tangled up in that. In our bathrooms, the floors get slick. A lot of us have tile in the floor that is really, really slick when it's wet. And also, if we drop shampoo on the floor, that gets mixed up with the water and that causes falls.
And I tell you, in a bathtub, the best you can do in cleaning your tub or whatever, but shampoo and hand soap, all of that, or bath soap, whatever you're using, it can linger on the bottom of your shower or your tub, and it can be slick. And one of the best things you can do in your bathroom is to put handrails.
True.
You need handrails around your tub. It's good to have handrails around your commode, because if you're trying to pull up and you've got maybe a little bit of back trouble or whatever, it's hard to pull up. And those handrails, but they need to be fastened good.
Yes.
But they are a lifesaver when you're trying to get up out of a location. If someone has a fall and they go to the hospital and the doctor says, well, you're going to have some physical therapy, what is the first step that they need to do?
Well, usually if the doctor sees that, he'll talk to you, if you're in the hospital, about having someone come into your home and help you out. And he usually will explain to you, what we offer, a little bit about what we offer. In the hospitals in our surrounding area, we have nurses and marketing people that goes into the hospital, and they'll help transition. But he'll write an order for the whatever he wants: physical therapy, occupational therapy, speech, nursing, and he'll have the case manager fax it to our office, and we have those girls that are there, or gentlemen, and they'll come into your room and set up home health, just talk to you about home health. But the doctor will ask you, we have home health services, would you like to talk to someone? And most people will say yes. And don't be afraid, and just up and say, no, I don't want anybody coming into my home. We go everywhere. We've been everywhere. We've seen everything. We have talked to everybody. So let us just talk to you anyway. There's a lot of people that, they don't have a lot of people coming into their homes, and they're afraid. This day and time, they're afraid of being robbed or taken advantage of. But we have certified people that are professionals that come into your home to help you. So we do take that order, and we have to have information from the hospital. If they're in the hospital, we'll have that information that the case manager will send us, and we'll have someone go out to the home, the nurse or the therapist, whatever the doctor orders, to evaluate and see what your needs are. And they'll talk to you about safety, your home environment, your medications. They get pretty in depth of what is needed, because the CMS guidelines, Center for Disease Management, Center of Medicare and Medicaid Services will, they pretty much set out the guidelines that we go by. So we have to have that information in hand, intact. And if we don't get it up front, we'll ask the physician or the hospital.
Well, now, I know what physical therapy coming in is, that they take you and try to get you to walk and get you to move your muscles. But tell us about occupational therapy. Are they going to put them to work?
Well, when they say occupational, I automatically think of working. But that's what we do with our upper body pretty much. We work with our hands, our shoulders, and that's what, when I think about physical therapy and occupational therapy, physical therapy works with everything, but with getting you to walk with your lower extremities. Occupational therapy focuses on the upper body, like your activities of daily living. They'll help you, show you, and guide you into how to safely take a bath, how to safely and more efficiently fix yourself something to eat. And they do look at all the safety, hazards in the home, and they make recommendations. They make recommendations on, like if you need and you don't have it, a walker, a cane, a wheelchair, things like that.
Well, does Medicare pay for a walker or a cane or a wheelchair?
Well, yes, most of the time they do. Things change. So, if I say, yes, you can get a walker, it just depends on if you've had a walker before, your diagnosis. So, the DME companies, if the doctor writes for a walker, a wheelchair, a hospital bed, the DME companies tells us what they need to cover that. And it's usually your physical ability, your diagnosis, and any other type of insurance that you have. So,
Okay, if I'm needing occupational therapy or even physical therapy, do I pay for this out of my own pocket?
if you have Medicare, Medicare pays 100%.
Now, are we talking about regular Medicare, or are we talking about Medicare Gap? I mean, Medicare Gap is regular Medicare.
The regular Medicare pays 100%.
What about Medicare Advantage?
If you have a replacement plan, Advantage. We always just put them in the system, run payer verification, and it will say, we pay 100%, or the patient will be liable for 50%, or you have to pay so much up front. But we will tell you when we go into the home, or before we go in there. When we get that referral, we automatically put it in our system, and it will show we put the insurance in there, and it will tell us what, the patient is liable for.
Well, now, I have also heard that there is some insurance, like the Medicare Advantage insurance, that does not pay. Is there different policies on that?
There's different policies, and I couldn't tell you, what does and what doesn't, but we can notify you, if we do get that referral, and we have all your insurance information and put it in the system.
That's something they need to find out up front before.
Yes.
And you will work with them on that.
Yes.
I have heard several of my seniors in the past tell me something about having vertigo or being dizzy or feeling like they were in a boat rocking back and forth. Have you had any experience with that?
I have. I had a car wreck in 2015, and they never did really find out why I was having the vertigo, but they thought it might have been my medications, or it might have been laying flat so much. But it was a really horrible thing. So I can identify and I can sympathize with anybody that has vertigo. And I didn't have any physical therapy at that time, but our therapist out of our Trenton office, I would contact them and say, hey, can you tell me what I need to do for such and such? And I think that I had a lot of pain, but the vertigo was probably the scariest thing, because it was just terrible. But they did give me some exercises to do, and they told me where I could look up online to get those exercises, and that did help. That did help a lot. So.
Well, I've heard, it's been mentioned to me, one lady especially told me that if she can get up and start walking with this vertigo, she can be okay, maybe. But if she has a hard time getting up and getting stable to walk across the floor.
And everybody acts different.
Right.
With, any kind of disease process or anything. It might affect me one way and you another way. But I did learn to control mine, but I did have it for probably 3 or 4 years. And it would get milder and milder, and knock on wood, if I got anywhere, I'm doing pretty good about it now. But you do learn how to control, and you do learn the triggers of what's causing your, personal vertigo. So.
Is vertigo similar to motion sickness in the way you feel?
It is. I know when I first was laying there in the bed and the first signs, I had some paneling on the walls, and it looked like they were going up and down. I would just look, and they were moving up and down all around the room. And I'd close my eyes, and when I closed my eyes, then I'd start spinning. So, 6 of one, half a dozen of the other. Both of them made me sick at my stomach. So, and everybody just, like I say, reacts different.
I know one gentleman that's a friend of mine, a couple of months ago, they thought he had a stroke because he got where he couldn't walk, just staggering, and he had to be led out to the car, and they took him to the hospital, and with thinking that it was really a stroke, but it was inner ear problems. He had an infection in his ear, and that was sort of hard to understand, but they were so thankful that it was not a stroke, but it took him several days, but he recovered. But he said it was like being on a boat out on the river and a storm coming up, just rocking back and forth.
Yeah. And some people, they'll say, well, I'll lie down and it looks like the floor's coming up to meet me. That's a scary thing.
It is a scary thing, because you don't really know how long this is gonna last. And, I know lots of seniors are by themselves, and this happens and they panic.
Oh, yes, I can see that.
I can see that. Well, do you have some kind of physical therapy or occupational therapy to help to help them?
We do, yes, they have exercises, you know, that, mostly the physical therapist works with that. And they've been trained, and they'll give you those exercises, and, they're hard to do. You know, for me, it was very hard to do because I would have all those reactions, but the more you do them, the less you have those episodes. So, you know, I would highly recommend. And we don't have a lot of referrals for that, but, you know, we go into, that's what I do, is I do marketing for Amedisys, for all of our clinicians and our services. And we go in and talk to the doctors and pass out flyers like the ones that I have given you that talks about the services, you know, that we offer. So I wished more people would see their doctor when that happens, where they could give a referral so we could help them right away instead of just wearing off over months. If you had a treatment that, you know, would help you within a week or two, would be a whole lot better than having it for months or years.
But if they don't know that, this is what this is all about, to let them know that. If they don't know it, they don't know to ask.
That's true, that's true.
And most of the time, if you're in the hospital, you want to hurry home anyway. You won't tell them everything's wrong with you.
No, I know you want out of there, that's true. And there's so many different things that causes vertigo too. You know, your medications can cause it, certain types of medications, disease processes, injuries, old injuries, you know, and just several different things that you really wouldn't think of. You know, I'm bad about getting on Facebook and seeing those things that crawl down your ears like the like the spiders or the little bugs. I'm always afraid at night, you know, but I've not had that happen. And there's another knock on wood. But you know, there's a lot of things that you don't think of. And when you start having problems with anything, you have to research and find out the cause and see your doctor, see your PCP, and he'll help you, you know, decipher that.
What about fluid? I've heard people talk about they have fluid on their eardrums or
Yeah, and a lot of people do that, and that'll cause you to have headaches and have dizziness, vertigo.
And sinus problems probably works along with that, don't it?
It does, it does.
So if somebody is concerned about getting help and learning about falling or fall prevention, then they need to contact Amedisys Home Health. Give them the phone number.
For the Dade County folks and Walker County, we have several Walker County people that comes to these physicians down here in Trenton. The number is 706. They've kind of recently changed it, but it's 229-8470, and that's 706-229-8470. And that will go into the Trenton office. And if you live in another area, if you want to call that number, they'll give you the area number that you live in, or you can get online and just go under Amedisys Chatsworth, Amedisys Ringo, and it'll pull up your number. And it'll usually have, most of them have their fax number and their local number on there too.
So if I'm dizzy or I feel like that I have vertigo or motion sickness or whatever, and I have a family doctor, but I have not been to him for this situation, what is my first step?
You need to call them. Call them, and they're doing virtual visits right now, a lot of them because of the COVID-19, and you have to have a phone. For us, it has to be an audio and a visual visit, or an in-house visit, face-to-face visit, for it to qualify. But they will do like a flip phone that you don't have any video, They will do that, but we can't accept that. We'll have to have something that they can actually see the person. But call them and see what you need to do. Set up a face-to-face visit with your physician.
Oh, I'd rather have face-to-faces go in person because they poke you, don't they?
And prod, yeah.
But you're saying that there is an exercise that you can do for the vertigo to help with that.
There is. It kind of gets. I don't know how you would put it. It's not monotonous, but you have to do like certain movements over and over again. One way, and then you turn your head and do it like this, looking straight on. Several different times, and having that vertigo and trying to do that, very, very difficult. And if you can't do it to start with, and it makes you sick, try it again. If at first you don't succeed, try again, because that vertigo, it needs to stop. It's bad stuff, bad stuff.
One of my seniors shared with me that it was like flashing lights going on, that you'd see things fly around, and everybody probably has different symptoms.
Yeah.
But now, somewhere I read about there gets to be a little crystal.
That's what they say.
In between your eardrums or
Yeah.
in the ear canal.
Yeah, and that's what that movement is for. And there's another movement after you do all those, or before you throw yourself back on the bed as hard as you can, and that's hard too. And all of that movement is supposed to break that crystal up, where it'll just go away, and that helps your vertigo. There's different types though. Everybody don't have the crystal, but it just depends. Like we say, the exercises that's done, that's what that's for, is to break that crystal up and get rid of it.
With Medicare, how many visits do they generally pay for?
Well, it's really unlimited.
I guess if they're seeing progress, it's more unlimited.
Yeah, they don't really limit, Medicaid limits visits, but Medicare don't. It just depends on the needs of the patient, the plan, the goals, what services the doctor orders. And, if you have nursing, physical therapy, occupational therapy, and some people have speech in there, that's several visits. And if you're under, like I say, Medicaid, those visits can be taken up really, really quick. So, but under Medicare, it just depends on your plan and your goals. But when we first go and set up the patient, and when the physical therapist and the occupational therapist evaluates, you as the patient help set those goals up, and it's personalized to you. Everybody don't have the same goals. You may just want to get in your wheelchair, get up from your bed in your wheelchair every day, get to your kitchen or to your bathroom and transfer to the commode and back up, and you may have somebody that comes in and cooks for you, so you might not want to do the kitchen, thing, but you might want to just at least do your transfers. And you may have somebody that helps you with a bath. But you may be a person that needs, you want to get up and you want to start cooking again. So that'll be a goal. And mostly the occupational therapist, like I said, helps with activities of daily living.
And they help you set a goal to reach to. And then when you get that goal reached, they help you set another one. I know someone shared with me that their insurance, they do not have regular Medicare, but their insurance policy they have would pay for 5 visits, and then they'd have to be reapproved.
Yeah, and we have several like that, but the nurses there at the office, they work with the clinicians that go in the home. And they also have to submit notes, things like that, to the insurance company. And the insurance company will say, well, you can have 5 more visits. Or we think they've met their potential.
Right.
So it just depends on, who's at the insurance company that's approving.
Mm-hmm. But the word of encouragement, don't ever give up.
No, and keep active.
Right.
That's the main thing with the falls. You keep active. I'm so tired by the time, I'm getting old too. So by the time the end of the day is done, I want to sit on the couch, But I know if I go straight to the couch, that's where I'm going to be.
Right.
But if I, get busy and do things with my granddaughter, then I'm not sitting on that couch or in the chair, and I'm active, and I feel better.
Yes.
I feel better.
When you wake up in the mornings, don't jump out of bed real quick.
Mm-mm.
Set up and get your bearings and get steady before you start trying to take a step. Because if you could have the tendency to fall if you're not real careful.
And a lot of people's blood pressure will drop if you get straight up from a lying position, and a lot more than you would think drops, and then that causes you to be dizzy, weak,
yes,
unsteady, and then there you go.
So then you have a problem. And lots of people, they take their medication at night, go to bed, go to sleep, and the next morning they're really needing their medication again, so they've got to get up and get with it. But always be cautious when you get up and steady yourself.
True.
And if you have to, put you a chair by your bed that you can hold on. If you don't have a walker, put a chair or a table by your bed that you can kind of stand up and kind of lean on that table a little bit.
And a lot of us have to get up through the night. And, we need probably a little night light. The lighting has a lot to do with us falling too and getting around. And as we get older, our vision gets lower, and the vision and the lighting, it's difficult, and it will cause falls.
Right. And, it's hard to get over a fall sometimes.
Oh, it's very hard, very hard.
Phyllis can probably share with us, she fell and did you break your foot?
I broke my foot. I had a bilateral malleolar fracture, and he said the orthopedic doctor said it's probably the worst one that he had seen. That I fell outside in a hole, being in a hurry, being old, being in a hurry, had to get things done, it was getting dark, and trying to get things in the basement, and I had built that hole there. I had dug me a little trench where the water would run away from the basement. Still hadn't got that fixed, but anyway, I was carrying a big ladder, trying to do 2 or 3 things at once, and fell on both my feet. They just went like this. And I had surgery on my right foot. My left foot was swollen and blue, but I couldn't feel it because I was hurting so bad on the right. But they put several pins in there, and I've got incisions on both sides, and I still have swelling. And I was down for 6 months. I didn't think I would get back to going again, but I had a scooter. They recommended me using a scooter in the house after a few days, and that was a lifesaver. I don't have any carpet in my house, and that was good too. So I was everywhere, and I could cook after a couple of weeks. But it was a different experience, and now I'm very, very cautious about where I step, where I stand. How I get around. If outside, I take my cell phone with me if I go outside, because my granddaughter lives with me, but when I'm outside doing my mowing and all that stuff, and she's not out there with me, I always tell her I'm going outside, I won't be back for an hour, check on me if I don't come back. And she gets busy doing her thing, But it makes you think. It makes you think when you went through that situation. If I hadn't had my cell phone with me that day, I would have probably been there in the hot sun in like 90-degree weather for 4 or 5 hours.
And that
Because
was,
she wasn't home that day, and her daddy wouldn't have brought her home, you know,
and that, you could have had a whole different story.
yes,
It would have been a different story.
yes, it was very hot, very hot.
And I've noticed that our ground is not as level as it used to be.
No. That's true, and that causes a lot of falls.
And as we get older, we need to do away with some of our shoes.
True, true, yeah.
And flip-flops and sandals wearing around sometimes will make you fall.
Heels,
Yes,
heels, big shoes.
right. So these are the things that us seniors can do to help some of our fall prevention. Just ideas that we would like to pass out to you, because we want you to be up and out and about and enjoying your life. And Phyllis, have you got anything else you'd like to add to this?
Not that I can think of, but just keep in mind, home health is here to help you stay safe and in the home and to live the best life that you can live. And please call me. Barbara has my number, or call to the office if you want to talk to me. I've gave out my cards to probably every senior citizen in Trenton and more. So if you can find my number there, or call Barbara, call the office, I'll be glad to talk to you about any services that we have.
If they'll just call me, 706-657-7434. Again, 706-657-7434. I will be happy to refer them to Phyllis, or I'll get your name and number and I'll have Phyllis call you. But we want the people in Dade County to be aware that there is help out there, and that Amedisys Home Health is a great home health service for our people in Dade and Walker counties. And we would just love to see you take advantage of that. Thank you, Phyllis, for coming so much and talking with us. We always look forward to it, and we just want our seniors and our friends in Dade County and the surrounding area to enjoy and have a happy life.
Thank you, Barbara, for having me.
Glad to do it. And we'll be doing this again before long, so be watching out for us, and thank you.